Hello guys, am I audible, clearly audible and visible to you? Let me know in the chat box. Am I clearly audible and visible to you, everyone? Let me know in the chat box. We'll start this session. Yes, perfect. Let me know once in the chat box. Everything is good, right? Audible and clearly visible. Perfect. Let's start the today's session. In this today's session, we're going to cover all the PYQs of ophthalmology, which is the important PYQs, and which topic is repeatedly coming again and again in the exams. We have the more focus on that particular topics, right? So as it is clearly audible and visible, just give the thumbs up in the chat box. So I understand that we have to start this session now. Just give the thumbs up in the chat box. So I understand that we have to start this session now. Perfect. Okay. Right. So let's just start the session. Yeah, I got the thumbs up. Very good. I think it's clearly audible and visible. So we'll start this session. Right. Increase the audio. Uh, just a minute. I will try to increase the audio. Just a minute. Okay. Just a minute. Just a minute. I understood. What about now? It's now perfect. Now tell me. I increase the volume. Is it perfect now? From my end, I increase the volume. Just let me know it's perfect on the YouTube also. Dr. Anonymous, right? You told me that increase the volume. I increase the volume. Just let me know once. Perfect now, Ruth. Okay, okay, okay. Let's start the session. And in this today's session, we're gonna cover all the important MCQs of the ophthalmology previous year questions, right? So let's start this session. And starting of this session, starting with the MCQ, just please understand the thing how to do this session. First of all, I will going to show you the MCQ on your screen. And just I want one thing, just you will answer me in the chat box about that answer of that MCQ. Okay, so when you're going to answer me in the chat box, I will understand that how much MCQs you are going to do the correct or not, right? If you have any queries between in this session, you can directly uh, drop your message in the chat box. I'm simultaneously I'm reading your live chat also, right? So drop me if you have any queries related to any topic, any question. Okay, so just one thing to make this session interactive, I need from you guys that when I'm show you the MCQ, first of all, I will show you MCQ on the screen and I will give you the 10 seconds time that you will answer in the chat box. So when you will answer, it will be much better and it will be a good interactive session, right? Okay, let's start. Right? Okay, so let's start this session. And starting with the session, I'm showing you the first important first MCQ in your in front of your screen. So a 50-year-old female patient present with a 50-year-old female patient present with the complaint of visual disturbance, and she reported that she is unable to see. The first of all, she is unable to see on the left side. So she cannot see on the left side, the first of the things. And from the left side, she cannot see from the left side, and the left eye of the left side from the right eye also. So she cannot see from the left eye from the left side, and from the right eye also from the left side. So she cannot see from this side. And she noticed that there is a central vision is remain intact. So the central vision is not gone, right? And it is unaffected. Okay, so what is the most likely? Visual deficiency. Very good, very good. I'm getting everyone's your reply in the chat box. It's too good. As I'm getting answering from you, all of the guys. Very good. Just tell me at which lesion will be there, at which level the lesion will be. Just tell me that. So it will be much better for me to understand that yes, you know about it. So I'm giving you the options also. The option is 1A is homonymous hemianopia. B is your quadranopia. Is a quadranopia is just only the quadrant will be not there. But here is not mentioned that quadrant is not visible. Here just the mention the half of vision will be not visible. The C option is your homonymous hemianopia with the macular sparing, and the option D is your heteronymous hemianopia. Right? So it means the region which is the remain here, the central vision is remain intacted. So this is your macular sparing, right? So the answer is your corrected. Yes, your answer is corrected is your C. Very good. Your answer is your homonymous hemianopia with the macular sparing. Now, what is this macular? What is your macular sparing? क्या होता है macular sparing? Just understand the thing. You can see here what the in the question they mentioned the left side left vision. This is left. This is right. This is left. This is right. Right. So the left side left vision is not clearly. So this is the visual deficit, right? And the right side also the left side. So it is your homonymous hemianopia, right? So if it's on the both of the same side, it is known as homonymous hemianopia. But you can see here the central vision. The central vision is intacted. So the central vision which is intacted here, this is your macular sparing, right? Very good. Supplied by your mid MCA and PCA. Very good, doctors. Very good, right? So this is your homonymous hemianopia, homonymous with hemianopia with macular sparing, right? So with your macular sparing, this is your macular sparing. The central sparing is your macular sparing. So the central vision will be not getting affected here. Please understand the thing. The central vision will not affected here. And now tell me at which lesion will be at in which in the visual tract, right? You know about the neuro-ophthalmology, the visual tract is there. So in the visual tract, at which level the lesion is there? Anyone of you? In visual tract. Now tell me, in the visual tract, at which level your lesion, right? Lesion at which level? Very good, guys. So this is your at occipital lobe. Very good, guys. This is at your occipital lobe, right? So in the occipital lobe, what we are seeing, homonymous hemianopia with macular sparing. Perfect, right? So did you understand this thing? Surely we'll take this particular slide will be there. I will take this session, right? Particular slide will be there where I will explain you all the levels of your visual tract where we'll be getting the defect and which type of defect will be seen like that. Okay. So I think I written just backside on the me. It's not visible. Okay. From next time I will write on this side, right? Okay. Right. So this is your occipital lobe. Very good, guys. Very good. So moving for the next question. Next question is in front of your screen and I'm waiting for your answers. I'm waiting for your answers, guys. The question is remain here. The safe strategy which is given by your WHO. The safe strategy which is given by your WHO, right? And it is the mainstream of management of the trachoma, right? So it is your trachoma. The safe strategy is used for your trachoma disease, right? It is used for your trachoma disease. So now tell me the one thing in the trachoma, what is the S represents? What is the letter S is represent? So the S letter is represent you about the surgery, about the symptoms, about the spectacles, and about the symbol. So what is your answers? What is your answers? I'm waiting in the chat box. Very good, guys. Very good. It is your surgery. But now my question is that you know about this question. I hope you solved the previous questions also, right? So you know about it. This S is represent your surgery. But which type of the surgery? Anyone of you can tell me which surgery? Like which type of the surgery is done in the trachoma, in the later stage of the trachoma? Anyone of you can explain me? Yeah, it's correct. Your answer should be here. S is represent for the surgery. So as they ask about the safe strategy, so we have to understand about the safe strategy very well, right? So starting with the understanding the safe strategy, that this is about the WHO is given this particular picture of your safe strategy, right? So this is the picture from your WHO, which is given by the WHO for the safe strategy. And in the middle of it, you can see here that it's clearly written that the safe strategy target is for the, what is the target of this your safe strategy? The target of your safe strategy is for the elimination as the public health problem, which, yes, your trachoma, for the trachoma as it is as a public health problem, so we have to eliminate. Please remember, maybe they can ask you about in the PSM also, it is they can ask you about the trachoma, and in the ophthalmology also they can ask you about your trachoma, right? So in which surgery, I'm again asking you the same question. They are talking about the which surgery? Anyone of you? I'm not getting any answer. They all you're answering, yeah, it's surgery, surgery, surgery. Very good. But maybe last time they asked about the surgery, right? Maybe they can ask you this time which surgery, right? Which surgery? Which type of surgery they are doing in the trachoma, right? So talking about this safe strategy very well again, that as is represent for the surgery, and it is done in the advanced disease. And please remember this, very good, very good. The pronouns and the main symptom of your trachoma, which is your trachiasis. Yes, this is about your trachiasis. And this trachiasis, it means your misdirection of uh, your eyelids, right? So uh, eyelashes, your eyelashes will be getting the misdirection. So your eyelashes is getting the misdirection, not the eyelid, doctor, not the eyelid. The eyelid is not doing to the misdirection, right? Your eyelashes will be getting misdirection. So your eyelashes, when doing the misdirection, it will going to rubbing again and again on your cornea, and it is giving the your foreign body sensation. So in the later stage, we are doing the surgery for the trachiasis. We are doing the surgery for the trachiasis. Now please remember. You have to remember. Maybe they can ask you this time about the which surgery we have to do, right? So this is about the trachiasis surgery. About the trachiasis surgery. Okay, right? Okay. Now moving forward for the next, it's talking about the antibiotic. It's talking about the antibiotic. Now, anyone, if you can tell me, like, which antibiotic is the drug of choice for the trachoma? Which antibiotic is the drug of choice for your trachoma? This is talking about the antibiotic. So which antibiotic is your drug of choice for your trachoma? And we have to do give the antibiotic against your chlamydia trachomatis infection, right? So you already know your trachoma is due to your chlamydia trachomatis, right, bacteria. So we have to give the antibiotic. Any one of you can give me in the chat box about which antibiotic should be given here. I'm waiting for your answer. Please remember, A is the same as your azithromycin. Okay, and how much azithromycin? It should be the 1 gram. Okay, azithromycin orally 1 gram. Okay, very good. Please remember with the antibiotic A, azithromycin. Okay, remember with the azithromycin. The F stands here for the facial cleanness. Okay, so we are saying to the patient to please make the hygiene about the face. You have to regularly you have to wash your face, right? And don't touch your dirty fingers to your face or the eyes. So we have to give the facial hygienist. And the E is representing here for the environmental improvement, right? So what is the mean of environmental improvement? The environmental improvement, so it will going to reduce your transmission of the diseases, right? So for the environmental hygiene is also mean, right? Not only the facial hygiene, the facial cleanness, the facial hygiene should be there, right? And we should give the patient to advise that we have to keep the environmental hygiene also. So this is all about your safe strategy. This is all about your safe strategy. All right. So this SAFE, this is your safe strategy. This is about your safe strategy. Okay. Right. So did you understand about it? So as I'm summarizing you about the safe strategy, I already given you the listed form also, and now I'm giving you in your tabular form also. That safe strategy is giving you as for this your surgery, and A is for the antibiotics. Please remember again the azithromycin 1 gram tablet orally should be given. Okay. Yeah, we can give the topical tetracycline ointment also. But if I'm talking about the drug of choice, I'm talking about the drug of choice, doctor. So the drug of choice should be your azithromycin only. Okay. F is here for your facial cleanness, and E is stand for your environmental hygiene. Environmental hygiene. Right? Okay. Perfect. Should we move forward? Right? Should we move forward? Perfect. Okay. Let's continue. Let's continue. Right? Moving forward for the now, the next question. The next MCQ is in front of your screen. Yeah. So the following the cataract surgery, the complaint of decreasing the visual acuity. So as you did the patient is had your cataract surgery, but after the cataract surgery also the patient is complaining for the decreasing the vision or the visual acuity. On the examination, there is a posterior, please understand, posterior capsular opacification. This is the most common complication of your cataract surgery. After the cataract surgery, there is a scene of your post capsular opacification, right? There will be scene of the post capsular opacifications are seen. So is seen, and now they are asking about the which laser can be used in this condition. So which laser should be used in this condition? So the MCQ is mentioning your options of the option A is your femto laser, option B is your anti-arc laser, and option C is your argon fluoride, and last option D is your argon. What is your answers? Very good, guys. Very good. I'm getting all of your answers. This is about your B, your anti-arc laser. Very good. It is your anti-arc laser. Now tell me, anyone of you can tell me what is the another use of your anti-arc laser? Any other use of your anti-arc laser? Can anyone of you can tell me? Is there any another use of your anti-arc laser in the ophthalmology? I'm waiting for your answers in the chat box. Is there any other use of your anti-arc laser in the ophthalmology? Just tell me. Yes or no? Okay. Your anti-arc laser is used in this condition of treating the patient of your post-capsular opacification. Okay. So we are using this anti-arc laser to do the clear out this opacification, which is the opacification just posterior to the capsule, right? So I hope you remember about the anatomy of your eye. In the anatomy of the lens, you know about the capsule also. So it is just behind the capsule, right? Okay. So this is about the capsulotomy also. You can say the capsulotomy. So I'm giving you a table here. Which is mentioned all the lasers and the effects and the clinical uses. So you can see here the organ laser. The argon laser, which is mentioned as the option D, was there. It was using the photocoagulation. It is your photocoagulation, right? And this photocoagulation therapy is used in your diabetic retinopathy. I hope you remember about the diabetic retinopathy. In the diabetic retinopathy, we have to see that there is a many small tiny vessels are getting to the rupture there, right? So as they are going to rupture there, we have to stop the bleeding. Okay, so for the stopping it, we are doing the photocoagulation therapy, right? You remember, this is the treatment of choice. This is the treatment of choice of your diabetic retinopathy, DR. Diabetic retinopathy ka your treatment of choice is what? It is your photocoagulation therapy. So in the photocoagulation therapy, we are using what? We are using the argon laser. Argon laser. The next is your anti-arc laser. They can ask you about the length of it also. So it is your 1064 nanometer is the length of your anti-arc laser, and it is doing the photo disruptive. It is the photo disruption, right? So argon laser was the photo coagulation. It is doing the photo disruption, right? And what is the doing in the photo disruption? It is doing the capsulotomy, as I told you, like is the posterior capsule opacification. So we do with the capsulotomy with there, and the important is your iridotomy. Now tell me, in which condition we are doing the peripheral iridotomy? Tell me, in which condition we are doing the peripheral iridotomy? Contraction of the anterior capsule, not like that, Dr. Priya, right? Tell me, in which condition we are doing the peripheral iridotomy? Anyone of you? Peripheral iridotomy, we are using the Andiag laser. In which condition? Anyone of you guys? Anyone of you can reply me? Okay, I think no one, right? So I hope you remember about the glaucoma. In the glaucoma disease, you remember that the your surgery of the choice. It is the your surgery of the choice. Okay, if we're talking about the if the it is doing the recurrency again and again. So this is your surgery of choice in that. Okay, very good, very good. So this is seen in your exactly. This is seen in your angle closer glaucoma, right? So it is seen in your angle closer glaucoma. So what is happening in the angle closer glaucoma? There is a your iris is getting attached to your lens posteriorly, and it is making the pupillary blockage, right? Remember that. So for the preventing this pupillary blockage, we have to do the iridotomy of the peripheral iridotomy. We have to do the peripheral iridotomy. For doing this peripheral iridotomy, we are using which laser? We are using the Andiag laser. Remember it. Okay, remember it. Very good. So prevent the recurrency of the acute angle closer glaucoma. Very good, doctors, right? The last laser is your excimer laser. It is a length of the 193 nanometers, and it is your photo ablation. Which kind of effect of it is? It is using in a photo ablation. So in the photo ablation, yes, it is a photo ablation. In the photo ablation is used in your LASIK surgery. What is the mean of LASIK surgery? It is your type of your refractive error surgery, right? So it is for the refractive error surgery. So this is your photo ablation LASIK surgery, and also it is a phototherapeutic. It is your phototherapeutic carectomy. It is in the phototherapeutic carectomy, right? So in the photo ablation, we'll do in the LASIK surgery, which is in the done is your refractive error surgery, right? And it is in the phototherapeutic, which is your carectomy. Okay, right? So this is about the lasers which you have to remember importantly. Let's move forward, and the question is in front of you. It is mentioned clearly that a 74-year-old male present had diabetic cataract. Now, first of all, tell me which type of the diabetic cataract, what we are saying in this particular type of the cataract, given the name of the diabetic cataract, just let me know. And from the 1 month, from the last 1 month, this patient is having the diabetic cataract. And this question is asking you the accumulation of the which of the following substance is responsible for it, right? So this is asking you about the which substance is here. But my question is that I'm asking you first of all, which cataract is caused by your diabetic cataract? Now tell me first of all. First of all, reply to answer my question, doctors. I'm asking you which named your cataract is there. Which type of the cataract? It is having the particular name of it, right? उसका एक particular नाम है ना? I hope you remember it. I hope you remember this. Very good. Very good. I'm getting your answers. Very good. It is your snowflake cataract. Very good. Yes. It is your snowflake cataract. Okay. Snowflake cataract. Okay. So this patient is what having? This patient is particularly having the snowflake cataract. So the question is asking here. Now you can understand the in a better manner. That question is asking you in the snowflake cataract, what is accumulation in the lens? What is going to accumulation in the lens? So the MCQ's option is given. Your glucose, fructose, lactose, and sorbitol. Please remember that. Don't be confused. Some of you are again and again answering that fructose also and sorbitol also. But if both are mentioned in the question, please understand this thing. If both are mentioned in the question, you have to answer the sorbitol. You have to answer the sorbitol. Don't answer the fructose. Okay, don't answer the fructose. You have to answer the sorbitol, right? So your perfect answer is your sorbitol. The sorbitol is going to causing accumulation of the sorbitol in the lens is causing your snowflake cataract, right? So how it is happening? Due to the excess of the glucose, as the patient is having the diabetes mellitus, the first of all. So the diabetes mellitus, what is the mean of diabetes mellitus? The patient is having the high level of the glucose, right? So it is having the high level of glucose. So the excess of the glucose in the blood, so it can enter into your eye also. It can enter into your eye also. And the important thing is here, which you have to remember, there in the eye, in the lens, your sorbitol is going to convert it, your glucose into going to convert it into the substance which is known as your sorbitol. Okay, so inside the lens, your glucose, because as normally also your glucose is going to convert it into the sorbitol, but it is not in the excessive level. We have the normal glucose level, so the normal sorbitol is going to make there and it is utilized. Okay, but now what is happening in this condition due to the diabetes mellitus? Please understand the thing, the patient is having the diabetes mellitus, he is having the excess of the glucose. So the excess of the glucose will be going into the now into the lens, and it will be going to convert it into the sorbitol. And please, the one and important thing, maybe they can ask you this time, like which enzyme is responsible for it, for the converting this glucose into the sorbitol. The enzyme name is your aldose reductase. Please remember this, aldose reductase. Yes, doctor, this is your enzyme which is known as your aldose reductase. Maybe they can ask you this time, like in the diabetes, in the diabetic cataract, your glucose converted into the sorbitol through the help of which enzyme, right? So it is by your aldose reductase, right? So as it is converted by the aldose reductase, your sorbitol is your alcohol, that kind of that, so it can be accumulated into the lens, and as it is going to accumulate it into the lens, it is causing your snow flake cataract. Okay, so as it is going to accumulate it into your lens, right? So it is causing your snowflake cataract. So I hope it is clear. Now is it clear to you? Okay, yes, please understand the thing, you have to mark the sorbitol, not the fructose. Okay, if sorbitol is not there, then you can answer the fructose. But if sorbitol is there and fructose is also there, just answer the sorbitol. You have to answer the sorbitol. Okay, very good, perfect. Should we move for the next question? And the next question is in front of you. A 62-year-old male who has the presbyopic glasses, who had the presbyopic glasses. Okay, so now tell me, first of all, for the presbyopia treatment, we are giving which type of the glasses? As it is a exam is very nearby, guys, so I hope you remember all of the things, right? I have to revise you all of the things. Now first of all, tell me, in the presbyopia we are giving which glasses? Okay, but now what is happening? But now he can comfortably read the newspaper without the glasses also. The patient is coming to you and telling you this the important thing, that as the patient was earlier, as you already know, the presbyopia is after the age of 40 onset. Okay, 40 years. After the age of the 40 years, there will be the presbyopia will be there. What is the presbyopia? The presbyopia is your physiological decreasing in the amplitude of your accommodation. All right, you already know about the accommodation. So what is happening in the presbyopia? This is the physiologically decreasing in the amplitude of your uh, amplitude of your accommodation, right? So this is the presbyopia. So at the age of 40, it is the onset of it, and now the patient is of the 62 years. So from last near the 20 or 22 years, or maybe 15 years, he is having the presbyopic glasses. He is using for the reading the newspaper. But now the main thing is here, that male patient which is coming to your OPD, he is saying you that without the glasses, now he can comfortably read the newspaper without the glasses also. So what is the condition? So first of all, please remember, in the presbyopia we are using the plus lenses, okay, or the plus glasses, okay. And please understand the thing, in the options is clearly given you the index myopia, index hypermetropia, regression of the presbyopia, and the none of the above. So first of all, I'm clearing you, none of the above is not possible, and the regression of the presbyopia is also not possible. Can you understand the thing? In the definition of the presbyopia only, I told you that this is a physiological decreasing in the amplitude. So if the physiological it is decreasing in the amplitude, it is possible to get again the regress of the presbyopia can be possible, guys, there, right? It is a physiological, as I already told you, it is a physiological. Okay, so it is not possible, the regression of your presbyopia is not possible, right? Just the only two options is remain there, the index myopia, index hypermetropia. As you understand, very good, guys, you all are answering very well. It is your index myopia, right? It is your what? It is your index myopia. Now first of all, understand the thing, what is the mean of this index myopia? I hope you know about the myopia. but you don't know about the index myopia, right? So what is the mean of your index myopia? Index myopia is seen in the cataracts. Importantly, it is seen in the cataract. And which type of the cataract? It is seen most commonly seen in your nuclear senile cataract. This is most commonly seen in your which type of the cataract? It is most commonly seen in your nuclear type of the cataract. Which cataract? Nuclear cataract. And in the nuclear cataract, there is what is happening. Please understand the thing. It is lead to the presbyopia due to the variation in the index of refraction of one or more ocular media. So now understand the thing. As you studied in your physics, there we have the mediums, like water is a media, right? Air is a media. We have the different refraction index of that particular the particular thing is having the particular index of it, right? Variation there will be, right? So what is happening in our ocular medias also, in our eye also, we have the different refractive index of the lens is different, of your cornea is different, right? So what is happening now in the lens, as it is getting the nuclear cataract, there's a variation will be there. There is a more variation in the your lens refractive index. So there will be the variation. As the variation is occurring in there, it is causing your index myopia. And you already know myopia, it means in the myopia we are using the myopia, it means your eyeball power is increasing. Yes or no? What is happening in the myopia? Now tell me. In the myopia, there is increasing the total eye power. Yes or no? So that's why to decreasing this total eye power, what we are prescribing? We are prescribing the minus glasses. Yes or no? You remember about the myopia, what we are doing? In the myopia patient, में होता क्या है? As the normally we are having the 58 to 60 diopter normal power, right? So it is more than the 60 will be there. So that's why what we are giving, we are prescribing the minus glasses to get the normalization, okay, for the normal. And in the presbyopia, what we are doing, as the amplitude of your accommodation was decreased, so we given the additionally we given the plus glasses. So now what is happening? Due to this index myopia, now there is a no need of the glasses of this patient. So now this patient is no need of the glasses, and he can read, or he or she can read the easily without the glasses of it also, right? So this is about the index myopia. Is it understand? Tell me, index myopia is understandable for you now? If you understand this index myopia, I'm waiting for everyone who are watching the live, just like the video, so I will understand that you understand all the concept which I told you about the index myopia. Just like the videos. I'm waiting for your likes. Okay. I'm seeing the like counter, right? Just like the videos. So I will understand that yes, you understand the all the concept, right? So we'll move forward for the next topic. Moving forward for the next question. The next question is in front of you, and it is mentioning that there is a male who has the elevated liver enzymes, right? What we are having? We are having here a male patient who is having the elevated liver enzymes. What is your liver enzyme? Right? SGOT, SGPT, glutamides, right? You already know about from the hepatology of your medicine part you studied, right? And what is the main thing from the ophthalmology? There is a ring-like structure is seen. There is a ring-like structure is noted on the ocular examination. On the eye examination, on this picture, what is the noted here? We are noting here a ring-like structure. Which of the following is cause of it? And now as I'm showing to you this ring-like structure which they are mentioning here, you can see here by this I'm mentioning here this particular ring which is covering here, right? Which is covering here from the outer side, you can see this one, right? So this particular ring, they are asking about this ring. And anyone of you can tell me in the chat box what is the name of this ring? Very good, very good. Already I'm getting the answer in this. Very good. This is your KF ring. Okay, clear Fisher rings. Very good. And this is seen in your very good, guys. Very good. Their options are given iron, zinc, copper, or selenium. So your answer will be here, the copper. Your answer will be here, copper, right? So this is the deposition of your copper will be going to show you about this. So now why they mention you about the liver enzymes? So I hope you can correlate it with your biochemistry or your medicine from the hepatology, right? So this is your seen in your Wilson disease, where it is going to seen in your, this is particularly seen in your Wilson disease. And your Wilson disease, in your Wilson disease, your copper is going to deposit. Yes, there is an increasing in the copper, right? So this copper will be going to deposit it in your descent membrane. Yes, you have to remember about this, all the layers. I hope you remember about all the layers of your cornea, right? So in the cornea, you have the descent membrane. In the descent membrane, you are going to accumulation of, you are seeing the accumulation or the your deposition of your copper, and this ring which is shown in the image, it is known as your Kastner-Fleschner rings, which is I already told you, which is short name is your KF ring. Okay, remember as a KF ring, right? So this is due to the axis of the copper, and due to this, the copper will be going to deposit it there, right? And this will be going to cause your, this will be going to cause your Wilson, due to the Wilson disease, right? Please remember, again, I'm showing you your KF ring. Please remember this image. Maybe they can ask you about your related to the image based question. So this ring, this copper, this one, right? So this ring, which is the peripherally, you can see near the limbus, you are seeing this, right? This will be the, this will be the your totally, this will be the round shaped ring will be your, this is the particularly ring shape is your KF ring, Kastner-Fleschner's ring. All right. So I hope you understand about this also, and you studied about the more about your Wilson disease in your in the your in the your biochemistry or the biochemistry or in your particularly in subject of your medicine. Very good. The Fleschner rings is also there. Very good. This is the Fleschner ring is also there, which is the iron deposition. Very good. We'll talk about that also. We'll talk about the Fleschner ring also, doctor. Surely I will tell you about the Fleschner ring also, right? Can anyone of you can tell me Fleschner ring is seen in which condition? The iron deposition on which layer there is a scene of your Fleschner ring? Surely. I'm waiting for your answer. Okay. I'm waiting for your answers. Let's move forward. The next question. The next question is here. Which of the following is the right lateral rectus yoke muscle? Which is the your right lateral rectus yoke muscle? Now, first of all, the my thing is here, which thing you have to understand to remember this question. If this time of the question is asking you in the later part also, so you will not forget about it, that the what is the your yoke muscle? What is the your yoke muscle? Now understand the thing. What is the mean of your yoke muscle? Yoke muscle kya hoti hai? What is the mean of yoke muscle? The first of all the thing, please understand, as we have the two eyes, right? So if I'm moving my eyes to the lateral side, the thing you have to understand, please understand the thing. If I'm saying my eyes to do the right gaze, which is saying is the right gaze, जिसको हम right gaze बोलते हैं. If I'm doing the right gaze, so my right side lateral rectus will be going to work. Okay, to moving this my eyeball to the right side. And although for my this left eye is also, for my this left eye is also moving, this my left eye is also moving to the right side. Yes, for moving this right side, I'm using my which muscle? This is the main thing. So I have to use, so as I'm moving my eyes to this side, so my right side, right rectal rectus is working. And for the my left side, please remember, my left side medial rectus is working, right? Which is working? Medial rectus, right? So this is the same action on the opposite eye. If I'm saying to do the right gaze, if I'm saying to the left gaze, this will be the seen in this condition, right? So this is what, which is the your yoke muscle of the your right lateral rectus? Exactly, this is your left lateral rectus. This is not, it is the other than, this is your left lateral rectus. And I'm explaining you again about the yoke muscle. The most importantly, two MCQs are from the your particularly from your the yoke muscle question. Okay, so I will ask you about it, so you will understand this thing. Sure, I will about the PDF. I will surely post about the PDF. I will give you the link of the PDF also in the chat box or in the comment box. I will pin that. Okay, and in the description of this video also you will find me, and I will give you the about the Telegram link also I will provide you now in the in between the classes, so you can directly go there and you can get the PDF from there also. Okay, you will get the PDF surely. You will get the PDF surely. Okay, so this is the same action, right? Which is the synogastric muscle is also exactly your yoke muscle is known as the synogastric muscle. So your right lateral rectus is your left middle rectus. Okay, is your muscle. Now I'm explaining you how this yoke muscles are working. For doing this, remembering this yoke muscle question, for understanding this yoke muscle question, first of all, you have to remember about, just a minute, guys. Just a minute, guys. Just a minute. Sorry for this disturbance. Uh, I think the touchpad pen is not working. Just a minute, guys. Trying to get it correct. Okay, now working, right? Okay, so screen is visible. Just let me know in the chat box once again if the screen is visible. Okay, so we was talking about it. We was talking about it, that which is your right lateral rectus. We are talking about the yoke muscle of your right lateral rectus, and I already told you this is your left middle rectus is your yoke muscle of the right lateral rectus. Okay, so if I'm talking about it, please understand the thing. What is the mean of your yoke muscles? What is the mean of your yoke muscles? This contralaterally paired of extraocular muscles. I hope you know about the all the extraocular muscles. Just I will revise you again the all of the things about the extraocular muscles also. Just understand the thing. This is a contralaterally paired that is working synogastrally. It means if I'm saying to do the left gaze, so my left eye is moving the left side, my right eye is also moving the left side. So there is a different muscles will be going to help to do this gauge, right? So this gauge is known as your yoke muscle. These muscles are known as your yoke muscles. Okay, so first of all, to understanding the yoke muscle, you have to remember about the all the extraocular muscles. This is about the your all the extraocular muscles. So you know about it. How much is the total extraocular muscles we have? We have the 6 extraocular muscles. How much we have, guys? We have the 6 extraocular muscles, right? So one by one, just go with me and please remember about the all the type of extraocular muscles, so you will understand this particular topic very well. Okay, so I'm giving you the example of it. I'm giving you example of it. Can you see here? What is we have? We have out of the 6, we have the 4 the rectus muscle. What we have? 4 rectus muscle, and the 2 we have the oblique muscle. Okay, so we have the 4 total rectus muscle, and the we have the 2 oblique muscles. We have the 2 oblique muscle and the 4 rectus muscle. Out of this, you remember about it. Just one by one, go with it. It's quite easy for you, as it is on the superior side. As it is on the superior side of the your orbit, it is known as your superior rectus. It is known as your superior rectus. Can you see here? This is your superior rectus muscle, and which is on the inferior side, it is known as your inferior rectus muscle. It is known as your inferior rectus muscle. Okay, so we have the superior rectus muscle, we have the inferior rectus muscle, we have the superior rectus muscle, we have the inferior rectus muscle. Okay, so the superior rectus is done, inferior rectus is done. Now we have on the lateral side, we have, so this is known as your lateral rectus muscle. You can see here, this is on the lateral side. So we have the lateral rectus muscle. Which muscle we are having on the medial side? This is known as your medial rectus muscle. Okay, so these are the 4 are the rectus muscles, and the rectus muscle name, the naming culture of your rectus muscles are given on the basis of the location, as which is on the which side. This is given the name of the same side. If it is on the superior side, it will be the superior rectus. If it is the inferior side, it will be inferior rectus. If it is on the lateral side, lateral rectus. If it is on the medial side, it is the medial rectus. Quite easy. And we have the 2 oblique muscle. First of all, you can see as it is going to attach the obliquely. Can you see? This is coming like that and it is attaching to the or eyeball obliquely. So this is known as it is attaching on the superior side and coming as the obliquely attaching on the obliquely. So this is known as your superior oblique. And one more, the inferior side also, one muscle is coming obliquely and attaching to our eyeball. It is known as your inferior oblique. So how much the total muscles? The total muscle we have six muscles. Which six muscle? Your this is all about the six extraocular muscle: superior rectus, inferior rectus, lateral rectus, medial rectus, superior oblique, and the inferior oblique. And just as you understand about the name of this, all of your muscles, just I'm going to remember you about the nerve supply of this also. It is very important, which is about the nerve supply. And for the remembering the nerve supply, just remember a mnemonic, which is your SO4 LR6. You have to remember SO4 LR6. It is a kind of equation. हाँ ऐसा लग रहा है कोई equation है. It's quite easy. SO4, it means your superior oblique. Your superior oblique is supplied by your fourth cranial nerve, fourth nerve, right? And your lateral rectus, your lateral rectus, your lateral rectus is supplied by your sixth cranial nerve. Okay, so now you are asking me, sir, okay, we understand totally six are there, right? Superior oblique is supplied by the fourth cranial nerve, right? The lateral rectus is supplied by the sixth. What about the others? So for the others, you have to remember this, all others are supplied by your third cranial nerve. Okay, so these are supplied by the third cranial nerve. Okay, it's quite easy to understand and easy to remember. We have the totally six extraocular muscles: superior oblique, inferior oblique, right? Superior rectus, inferior rectus, lateral rectus, and the medial rectus. Exactly. So we have to remember the mnemonic. You have to remember this mnemonic. It is a very, very important. Okay. So as you remember this mnemonic, SO4 LR6. So the superior rectus is the fourth nerve, lateral rectus sixth nerve. Rest of all is supplied by the third cranial nerve. Rest of all is supplied by your third cranial nerve. Right? I hope you remember about this now, the supply also. Now, one thing which I want to tell you, it is a very, very important, which is about the Yoke muscle. We was talking about the Yoke muscle. So understanding the Yoke muscle, for the understanding the Yoke muscle, I have to show you the two diagrams. I have to show you the two diagrams of your eyes. As you have the two eyes, so I have to show you the two diagrams here, right? Simultaneously. So you can see here, I am mentioning here, it is your left side of the eye and it is your right side of the eye. Yes, I hope it is clearly visible to you, right? So this is your left side of the eye and one is your right side of the eye. Perfect, right? The one thing which I'm going to tell you here, as I told you, the Yoke muscle is what? Your Yoke muscle is your which is working synagogually. Okay, so in the MCQ they ask, I'm showing you first of all about the MCQ. We are talking about the MCQ only. Just a minute. I did a mistake. Okay, so this is your right eye. Okay, as I'm seeing on the screen, it is will be the opposite for me. Okay, so this is the right and this is the left. Yeah, now perfect. Okay, and there will be the little bit changes. I have to do it. Just a minute. Just a minute. It cannot be uh, understandable if okay, I will explain you that if it is the nose, if it is the nose, right? So here will be the medial rectus, okay, from this side. The image is one side only. So this will be your medial rectus and this side will be the lateral rectus of the left side. Okay. Sorry for this. Right. Now it will perfect. Yeah. Mirror the image. The mirror image was not possible there. Right. It was the image of the one side eye only. Okay. So now it is perfect. I think you understand the thing. I made it. Okay. So this is the lateral rectus for the left side. And the question is asking you about it. In the MCQ, they ask you about that the right side lateral rectus, this one, the synagogistic muscle of it. They are asking, or the Yoke muscle of it. So what do you mean by it? What is the work of it? What is the work of the lateral rectus? The lateral rectus is doing the right gaze. It means it is going to move your eye on the right side. This is your right side. Okay, so this is working on the your right side. Okay, it is going to working on your right side. Now, if for the working for the right side, if it is working for the right side, it is moving the eye to the right side. So our left eye will be also moving the right side. Left eye भी काम move करेगी. Left eye will also move the right side. So for the moving this left eye on the right side, which muscle will be going to work? Your medial rectus. So your right. So the question is they asking you about the right lateral rectus yoke muscle is what? The right lateral rectus yoke muscle is your left medial rectus. Okay, right lateral rectus yoke muscle is your left medial rectus. Is it understandable for you? It is understandable for you, which I told you here. Just one again, I am asking one more question to you. If you answer that, that will be perfect for me. If I'm asking you about the left lateral rectus yoke muscle, what is the left lateral rectus yoke muscle? I'm waiting for everyone's comment in the chat box. I'm waiting for the comments. Everyone's comment in the chat box. What will be the muscle? What will be the muscle? The yoke muscle of your left lateral rectus. Which muscle? Try to answer. Try to answer. Try to answer, guys. I'm waiting for your answers. Am I audible, guys? Let me know once in the chat box. Am I clearly audible? Am I clearly audible now? I think there was a network drop. I think the screen was stuck. Now is it perfect, audible and visible? Okay, okay. I think there was a lag, right? Or only it was on my screen. I think you also face the lag, that lag. Okay, now perfect. Okay, so I was asking about that this is doing. Okay, so your left side, so your left side muscle will be doing the your left lateral rectus will do the, yes, your left lateral rectus will do the left gauge. So on the left gauge, what will be happening on the left gauge? On the left gauge, what? Okay, between the comments, right? Okay, so there will be the left gauge, it will do the left side. So for the right eye is also moving for the left side. It is done by your medial rectus. It is done by your medial rectus muscle. Which medial rectus? It is a right medial rectus. So from this, there is a four important MCQs are there. Hello? Importantly, there is a four important MCQ. They're asking and confusing you in the about the yoke muscle again and again, again and again. So what I'm thinking to make it quite easy for you to give you a slide that you will remember that. So write it down with me. This is about the yoke muscles. Okay. So first of all, I'm writing here. The first is your left lateral rectus. Okay. The second is your left medial rectus. Third is your right lateral rectus. Fourth is your fourth is your right. Fourth one is your right medial rectus. And I'm waiting for everyone's answers. Try to answer in the chat box. Write it down 1, 2, 3, 4, and write it down your answers. Okay. So this is the more important. Okay. This is the important thing. They can ask you about the yoke muscle. Okay. From out of the yoke muscle, they can ask you about this importantly, these four questions to confusing you. Okay. To confusing you. But if I'm making here a list of this particular topic, so I hope you will remember this list. It is quite easy list. So you will remember that. So write it down in the chat box one by one. Okay. It is the right. Very good. So it is doing your what? It is showing you what? It is going to show you the right side. What? Very good. It is going to show your right side medial rectus. Okay, so left side lateral rectus. Okay, so it is doing the left gauge. So our right side medial rectus will be going to work. Okay. Yes, guys, I am also facing the lag in the comments also. I don't know why it is the lag. I'm trying to. There's a 0%. The drop frame rate is perfect. Uh, I think now it is perfect, right? It was a lag between it, but now it is showing perfect. Okay. What about the left medial rectus? For the left medial rectus, we have the right lateral rectus. Very good. Okay. Just opposite of it, you can see here your right lateral rectus will be your left medial rectus, and your right medial rectus is having the left lateral rectus. So this is the four important. This is your four important Yoke muscle question that they can ask you and confuse you in it. But now I given you in a tabular form. Okay, so revise it, and it is quite easy if you are understanding this in once. If you understand the concept, अगर आप concept समझ गए, so they cannot confuse you. Okay, they will never ever confuse you. Okay, right? Should we move forward? Okay, moving forward for the next question. The next question is here: in which of the wall of orbit, in which wall of the orbit is the lacrimal sac is present? This question is from your lacrimal system, right? Lacrimal drainage system. Okay, so they are asking a question from the lacrimal drainage system, and I hope you know about the lacrimal drainage system also and very well. I'm waiting for your answers. So your lacrimal sac is situated in your lateral wall of your orbit, medial wall of the orbit, superior wall of the orbit, or the inferior wall of the orbit. I'm waiting for everyone who are watching live this sessions. I'm seeing here the 23, 24 students are watching live here. I'm waiting for everyone's comment, right? Please try to comment. Everyone, I need everyone's comment who are watching live here. I'm seeing everyone's comment. Very good, guys. Very good. Very good. Okay. So some of you confusing in C, some are replying C, some are replying B, some are replying D. Okay. I'm clearing you. Your answer should be, they're asking about the lacrimal sac. Please remember about it. Please remember about it. They're asking about the lacrimal sac, and your lacrimal sac is situated in your medial wall of the orbit. Please remember, the answer should be your medial wall of the orbit. Now I'm showing you how it is situated in the medial wall of the orbit. Just remember that this is situated in the medial wall, the lacrimal sac, which is presented in your medial wall of the orbit. Now check this image, and I hope after the remembering this image, you will never ever forget about your lacrimal sac. So this is your eye, you can see here. So on the superior temporal side, this is your superior temporal side. This is your superior temporal side. We have the lacrimal gland. The important thing of your lacrimal drainage system or the lacrimal system, we have the lacrimal gland. Okay, so this lacrimal gland is where? It is on the superior temporal side. On the superior temporal side. And from the superior temporal side, it is having the ducts also. You can say the ducts of lacrimal gland. Okay, so this ducts will be producing your tears, and tears will be coming on your eye. And after the passing through this whole eye, making your tear film aqueous layer. The aqueous layer, I hope you remember about the layers of your tear film also. So making the aqueous layer of your tear film, it is coming on the medial side. This was your lateral side of the eye. This was your medial side of the eye. Okay, so it is coming on your medial side. On the medial side, what we have the small openings here available on the medial side, and this opening is known as your punctums. So one, we have the superior lacrimal punctum, and the secondly we have the inferior lacrimal punctum. We have the two, superior lacrimal punctum, and one we have the inferior lacrimal punctum. How many we have? We have the two. Okay, so this punctum are the small openings are there. Okay, what is this? These are the small openings only. Okay, out of this opening, now what is happening? Out of this opening, there will be the tear will be getting absorbed. Okay, and this tear will be getting absorbed from this particularly getting from this, and it is getting particularly will be there into your, where it will be the into your punctum. Punctum se kya hoga? It will be going to punctum, right? it will be going to the punctum, and punctum, after the punctum, it will be going to your lacrimal canal. Okay, after the punctum, it will be going to the lacrimal canal. So it is having the punctum, and we have the caniculus, or the, yeah, caliculi भी same बोलते हैं उसको, canal is there. Okay, so after this canal, and now this both the canal will be going together and going to join together. It will be known as the common canal or the common caniculus. Okay, caniculus, common caniculi, or the common canal. And this common canal will be going to drop into your lacrimal sac. Where will be going to there? It will be going to drop your tear into your lacrimal sac. And this lacrimal sac, now please remember about it. This lacrimal sac is situating in where? It is situating on your medial side. What do you mean by the medial side? Like I'm showing you in front of me. Just check it out here. This is your medial side of the eye near the nose. Here I am having what? Here I am having my lacrimal sac on the both of the eyes. I am having here on the medial side. Okay, so this is your lacrimal sac. Now the important thing which I'm going to cover here also, as we covered this whole lacrimal system, so please understand this thing also. After this lacrimal sac, your tear will be going to drop into your nasolacrimal duct. What do you mean by the nasolacrimal? Naso, it means the nose. Lacrimal, it means your tears. So it is a connection between the eye and the nose. So it will be going to drop into this nasolacrimal duct, and this nasolacrimal duct is open at. My question is from you guys. I hope you already had the ophthalmology lectures or ophthalmology subject, right? So my question to you guys: this nasolacrimal ducts will be going to open in which area of your nose? Anyone of you? I'm waiting for your answers. In which area of the nose it will be going to open? Waiting for your answers, guys. Try to reply answer. This is the same question. I hope you studied in your ENT subject also about the nose. Okay. And you studied in the ophthalmology also. Right. So it will be going to open into your where? We have the important three things. Okay, we have the meatus and the turbinates. Please remember all the openings are in the meatus. Okay, and this particular duct will be going to open into your inferior meatus. Okay, so it will be going to open where? Inferior meatus. Please remember, it will be going to open at your inferior meatus. And the one important thing which I'm going to tell you here, it's open at the inferior meatus. At the level of inferior meatus, we have a valve here, kind of a valve here, and this valve is known as, one valve is there, right? Valve kya hota hai? Like we having the valve in our houses also, right? If you are opening it, the water is coming out. If you are closing it, the water is not coming. So it is having a valve like structure, which is known as valve of Hasner. Okay, so remember this valve. What is the name of this valve? This name of this valve is your valve of Hasner. All right. So this is about this is all about your lacrimal system or the lacrimal drainage system. I hope it is clear to you, right? I hope, is it clear to you about your lacrimal system, about the important thing about the lacrimal system? I already covered importantly things. Remember this image, and please remember your lacrimal sac. Exactly, wall of Hasner. Your lacrimal sac and the lacrimal punctum all are on the medial side. And please remember, don't forget about it. As the earlierly in the previous question, they asked you about the lacrimal sac. Maybe they can this time ask you about the lacrimal gland. So lacrimal gland is on your superior temporal side. It means the superior, it means the above, and the temporal side. It means if I'm showing you, please check it out here. This will be here. Okay, it will be here on the above. Okay, so this is about your lacrimal gland and about the drainage system. I hope you understand this perfectly. If you understand, give thumbs up in the live chat box, so I will understand that you understand this topic very well. If you understand this topic, please give thumbs up in the chat box, so we'll move forward for the next MCQs. right? Okay, very good, very good. Okay, now moving forward for the next is the question is given here. The 7-year-old boy, there is a 7-year-old boy is having the amblyopia in the right eye. What is the preferred treatment? What is the preferred treatment for this particular amblyopia? So that if I'm shorting out and giving you the one-liner question, easy question, making it easy, this question, they're asking about the what will be the treatment at the 7-year-old child in the amblyopia. What will do the treatment? The option A is saying the observation. We have to observe it. Option B is saying the spectacle of refraction with a near addition should be there. Option C is saying the occlusion therapy. And option D is saying the radial keratom. So I'm waiting for your answers. What will be your answers, guys? What will be your answers? What will be your answers? Okay, some are getting confused, some are replying C, some are with B. Okay, okay. Please understand the thing. The answer should be here. The answer should be here. Occlusion therapy. Your answer should be here. Answer C, which is your occlusion therapy. What do you mean by the occlusion therapy? Please understand the thing. What do you mean by the occlusion therapy? I'm going to show you the image of occlusion therapy also, right? And how to use this occlusion therapy, I will going to tell you, right? So the occlusion therapy, it is an eye patch. The eye patch is going to use in this, and we have to cover the non-amblyopic eye. It means we have to cover the normal eye. Okay, so like in the MCQ, just I'm going to show you that they are mentioning the right eye is the amblyopic. So if the person is having the right eye amblyopia, I will cover which eye? I will cover the left eye. Okay, with the patch, I will going to cover the left eye, which I will going to cover the normal eye, non-amblyoptic eye. जो non-amblyoptic eye है, मैं उसको क्या कर दूंगा? Cover करूँ. I have to cover the good eye. Very good. I have to cover the non-amblyoptic eye, normal eye, or the good eye. And what I have to do, I have to cover it for the couple of the hours in each day, right? Slowly, slowly, I have to cover daily by daily to this non-amblyoptic eye with the this cover, and it is known as this condition is known as your occlusion therapy. Just I'm going to show you about this occlusion therapy image, so you can see here. So you can see here the patient is this is the patient in front of you. This is the patient's right eye. This is the patient's left eye. Okay. So this patient is having what? Right eye. The right eye is the amblyopic. So I covered the normal eye. This eye, left eye is the normal. Please understand which eye is covered. It is the normal eye should be the covered. Okay. And the right eye is there. Exactly 6 hour duration will be increasing slowly, slowly. Like in the starting 2 hours, then for the next day or the for the next some days we will increase the 1 hour. It is for the 3 hours and 4 hours. Now your mind is saying, so what do you mean by this using this eye patch? Only using this eye patch, and although if you're using this eye patch, you are covering the normal eye, right? You are not doing anything for the treatment for the abnormal eye. You are although covering the normal eye, it was helpful or not. So for just covering it, I have to give you important information about the amblyopia. So I hope many of you remember or you know about the amblyopia. Many of you don't know, right? So we have to talk about this there, but I don't know why this is